Hi guys, welcome back to a Life of Education's podcast. We're here with Taif Delaney and Hannah Wilkinson. Taif and Hannah recently got married, but we're still on individual names for now. We were talking about just before the podcast. So Taif is what do you class yourself? A strength conditioning coach, rehab specialist?
Yeah, so at the moment I'd classify myself as a sports therapist because that's what my DHA license is.
Right.
So within Valiant Clinic where I'm working at the moment, that's what I'd be referred to. But essentially I do all exercise-based rehab, so I don't do any hands-on treatment, specifically exercise. To help, injuries and late-stage rehabilitation or achieve clients' goals, be whatever they are.
And you do that in the clinical setting?
In the clinical setting, yeah.
And Hannah, you're part of the team there as well?
I am, yes.
Head of the team?
I'm the head of the physiotherapy team.
Yeah.
So
at Valiant as well?
At Valiant, yep. My specialties are obviously running, rehab, prevention. I do a lot of exercise-based work, but we do obviously hands-on work also. So using things like the instrument-assisted mobilization. So worked on the fascia a little bit more. Manual therapies, so mobilizations, mulligans, these types of things.
So running enthusiast gets injured, goes to the doc, goes to the physio, sees you first. You do the assessments.
Yep.
You do the acute stuff.
Yep.
Hand them over to Taif. Then you take them through the re-strengthening stuff in the gym, and then off they go back out on the track.
Exactly. So we've got a nice little continuity.
Yeah, it's good. It's the best way to do it. What kind of clients are you seeing? What kind of people would come into you?
I'm very lucky. I've got a real variety of patients. I have, average Joe who doesn't do any exercise at all, sits at his computer all day, has neck, back, shoulder, knee pain, whatever it is. But off the back of that, I actually work with some international athletes as well. So with them particularly, it's more looking at obviously injury prevention, trying to maintain them through their season and get them in line ready for their races that are coming at specific times. So that's where Taif's help really comes in, because I have to maintain them to a certain point, and then we have to make sure that they're ready for their races.
So do you see them before they're injured? They just come in for a little fine tune up and...
Yeah, so we've got a couple that I keep an eye on. So we do some screening, make sure range-wise that they're keeping everything at a certain level, because if you get too many deviations, for example, if you get really tight through your hips, all of a sudden you've done increased load or volume, whatever, the last couple of weeks, then you can sometimes find that the body reacts in a certain way, and in that level of athlete, it's not great to just allow them to continue, because they'll come back, within very quickly, sore knees, Achilles playing up, these types of things. So then we need to say, right, okay, well, you need to back off a little bit. We'll just open this stuff out, and then you can carry on, because otherwise I have to fix when they're actually injured themselves.
So. Chuckle to myself there, Keith. You were saying that. Do you see them before they're injured, or how do
we like to?
No, the runners and endurance athletes as a whole are always carrying some form of injury. They have the mentality they'll just push on through it, which is actually great from in terms of when their compliance is very good when you give them exercises and rehab to do, because they understand what hard work is and etc.
Sometimes a little bit too compliant.
Yeah, I mean they're the kind of ones you'll have to reel in. As clients, as Hannah said, we see such a wide range of clientele. Some of them, they're the ones that you have to really encourage
motivate
them.
Like the couch potato clients.
Yeah, exactly. Yeah.
So that you give them a piece of paper with the exercises and they never look at it.
The doctor in work jokes to me and says, the prescription for this person is just a good kick up the backside, to get them compliant. And then the other ones, like your, very focused endurance athletes, you really have to reel them in, and that's an art form in itself, is trying to determine who needs what from a compliance point of view. It
does make a huge difference, because sometimes you'll say to them, go off and I want you to do this in the morning, I want you to do this in the evening, and they come back in the next day and they're like, oh, something's really sore, and I'm like, what did you do yesterday? It's like, oh, well, I did that and that and that in the morning, and then we did it again at lunch, and you're like, that's not going to help you.
Yeah.
Too much. Come on, guys.
We sat down with one of the Team GB athletes that we work with, and we said to her, we looked at her previous season, and it was her first real push into that, that level of elite sport, and she'd completely overdone it. She'd basically trained really well and then overdid it, overtrained, didn't listen to rehab advice, and really struggled through the remaining part of the season. So we had quite a frank discussion with her and said, looking back on last year, what changes would you make, and what are we going to do differently this year before we proceed and make all our plans?
Uh-oh.
And she was on, she was on board. And
We basically said we're not blue tacking you together for this
Yeah.
season. because That's what we did last season.
Yeah.
So
I have a little bit of that problem too. Like when someone says not to do something, I overdo it so much, and then my feet hurt so much I can't walk for 5 days. Like it must have been the run, and everyone told me not to run.
No.
So I understand. I think when people are really eager to get started and eager to get better or eager to like win their race or something, they have this motivation, and that makes them not listen to anything that a professional might advise them. That's just
generally you find
from my point.
the more experienced athletes can appreciate that with regards training and rehabilitation, there's a right amount to do, and that only you find more the novice ones, even they could be competing at a high level, but they're relatively young in terms of experience. They're the ones that associate hard training or hard rehab with achieving their goals. It's the more experienced ones you find that they've made these mistakes, and they go, actually, you know what, maybe in terms of running, it's good to do some low heart rate training because I can utilize my fat stores better, and it improves my running economy. And then when I do my rehab, if they say do 2 sets of 10 reps, I do that and not 50 sets and pick a heavier weight. So
You trying to say I'm a novice athlete? No, I'm just stubborn.
Yep.
Basically.
It's just that idea, isn't it? That more is better. Just always more and more and more, because these guys have to run faster. They've got to jump higher. They have to do more on the day of their performance.
And I also think that people really are very undereducated about the importance of rest and recovery. Like it's almost like the last thing that you learn about when it comes to like any type of sports or anything like that. It's like, oh, I have to rest, really? I think people learn about it less. So when people like you guys educate them about recovery and rest, you do that, right?
And it's still like an ongoing battle, particularly in sort of the elite side of things, or very experienced semi-pro athletes. I had one that I worked with last year, and I just could not get him to rest. Like he would just train every single day, irrelevant of what was told to him or anything else. And I think he managed to muddle through because he'd been training working up to this level for like 7 years, and I'd known him for sort of 4 years, and each year we'd had, again, blue tack him together before a race because things had gone wrong, whereas last year we said, no, right, well, I'll manage you this season, let's get you through. And one of my stipulations was, I want you to have a day's rest every week. It completely ignored me, which is up to him. And he did have a good season. He didn't get injured, but that's not sustainable, especially for endurance athletes when you're running marathons, half marathons, the impact and the load that you're putting through your body and your tendons. You need to give it time to rest and recover.
And I think, I don't know where I saw this, but maybe I saw it somewhere. Someone was explaining the importance of sleep, and they were actually showing it on a graph how well people improved physically if they actually slept 8 to 10 hours a day, what their game was like the next day. How is that right?
Yeah, so what was really interesting, we did a postgraduate diploma in sports and exercise medicine 2 years ago with the University of South Wales, and I thought the majority of the course would be related to the most current research on ACL reconstruction rehab or low back pain and how to deal with it. But a lot of the push in the medical profession now is to think more holistically, and I know you've had guests on in the past on this show to think about things like sleep. If you're taking your client's subjective, so you're taking their previous injuries, their lifestyle, and before you get onto injury, and if they're sleeping 3 or 4 hours a night, the emphasis is to address that. If you're not the clinician to do that, to refer on to someone, you look after the injury side, but make it apparent to them that this is something you're going to have to also improve on, and give them a referral pathway for that. So yes, hugely important things like sleep, nutrition, etc.
There's actually quite there was a research study out just within the last sort of 6 months, I think, particularly looking at endurance athletes and highlighting that if you're not getting enough sleep, the impact that has on your performance. Because physically, if any of your viewers are endurance distance runners, like, they will know, you wake up one day and you just feel absolutely shattered, you're not going to have your best run that day. So it's common sense, as well as what the science is saying, is that if you're not sleeping enough, you're not resting and recovering, and you're not able to then give your best output in terms of racing and training performance.
Reading a book, Born to Run, isn't that? Yeah. And they were talking about the big difference between professionals and amateurs, but that is not so much the training they're doing, because a lot of the you can only fit in so much training throughout the day, but the difference is what happens in between that. The amateur goes to work from 9 to 5, has X amount more stress, isn't able to have that afternoon nap, isn't able to have that sports massage, isn't able to really plan their meals as well. And he said that was the biggest difference, not so much the actual training. The amateurs can frequently get in as much training as the professionals, but it's what happens in between. And I thought that was an interesting point to make.
Yeah, I've got that book at home. I haven't read it yet. It's on my bookshelf.
Gives you the running demon. You'll read a chapter and you're like, right, shoes on, I'm going for a run.
Yeah.
And you get back and like, I'm going to read another chapter and like, can I go for a run again?
Signed up to the Creek Striders half marathon, which is in how long? 6 weeks?
Something like that, yeah.
Not one run done yet. Not one.
I've been having a timeout. It's okay.
So you need a good dose of kick up the ass on your
program? Married to Taif, I've got no chance.
Is where people should be.
Amazing.
Well, good luck with that, Hannah. We'll look forward to hearing how that goes.
How's your marathon preparation going?
I've got to do like a 22 tomorrow, so I might have to.
Aren't you're in running in Vietnam, right?
In 6 or 8 weeks. So I've got like a
okay.
I've got to get over 21, 22 tomorrow. The problem here with it is the weather. It's just you have to go out so early.
Yeah, you do.
It doesn't matter how fit you are, whatever. When the sun comes up over 9 a.m. and you've been running for an hour already, or you're running for an hour and a half, 2 hours, you just shut down. Like, that's how, as an amateur, not as somebody who can push through these high level things. You've got to be up at 5, and then you got to be on the track by 5:36. If you're going to run for 2 hours, you need to finish before 8. That's so difficult, So we'll see how I go. I mean,
should we clear our schedule for next week?
Well, I need to clear my schedule. I need to sleep during the day and then start running at midnight.
But the weather in Vienna should be quite a lot cooler than here, so you do get a little bit of an advantageous.
He's going to Vietnam.
Oh, yeah. Vietnam. So
yeah.
Vienna.
No, Vietnam.
That's going to be
at the end of November.
Humid.
Yeah.
Okay, good, lovely.
It's going to be fun.
I've got no help for you on that one, I'm afraid.
So yeah,
just hold on tight.
Let's hope.
So basically, Keith will be coming to see both of you.
I probably should have already been.
I thought
to
you were
see
going to come
anyway. Well, because somebody told me this might be an interesting way to think about it. Somebody told me the Born to Run book is going to make me question how I run. So when I bought it, I was like, okay, let me see if there's kind of merit in this. And then as the preceding 2 weeks went by, so basically it's a heavy 4-foot running book, isn't it? Or it talks about the difference between the two.
Yeah, it's one of the themes throughout it is that discussion about trainers, barefoot, forefoot, etc. But this is definitely Hannah's area, so I'll let her.
Yeah, I'm really curious because everybody debates this, and I hear lots of people talking about it. We've got a lot of friends and a lot of people who have been on the podcast before who are very adamant about like barefoot running and the benefits and etc.
Are they all part of your yoga?
Oh, maybe, but I'm part of that yoga community. I could never do barefoot running; my feet would fall off.
Yeah.
But so, what's your opinion on that?
It's a very individual approach from my point of view. I do a lot of running analysis with people. So part of that session is that I do look at them run in bare feet. And some people are just more susceptible to having problems if they were to do that. So for example, if you're somebody that's got a really high arched foot, people with, we call it a high equinus. So people with a high equinus can struggle to get enough pronation sometimes. And if there's someone that's always been shod, so there's someone that's always worn shoes, they're probably not going to be my favorite candidate to say, let's put you barefoot. Let's see how that goes. Because with the high equinus, the pronation availability is somewhat limited. They tend to not be able to get quite as much pronation as someone with a more neutral foot. It also depends on what you're after. So if you're looking to run 10K on the road and you're super keen to go into a minimalist shoe, I'd say, okay, yeah, fine, but it's going to take you 2 years if you're someone that's always worn shoes, because your feet are not used to it. And this was the big thing. So when these low profile minimalist shoes came in, there was one brand in particular, obviously, that there was quite a lot of people buying them thinking, oh, they look cool, and then they were getting injured. If you take your feet, that if you've been in shoes since you were a child, and then you try and make yourself run without any shoes on concrete, you're going from a low level load with some nice cushioning to a much higher load with no support, like no cushioning underneath your foot. It makes sense just to say that you're going to get injured. It's a no-brainer. And particularly sort of stress fractures into the feet, fifth metatarsal, these types of things, they were really prevalent when this fad began. So there is a good amount of evidence to say that when you take someone from a shod run, so running in a shoe with a good sole, to barefoot or a minimalist shoe, you tend to see a bit of a difference in their gait pattern. So in a big heeled shoe, you tend to see a lot of people heel strike. It's a big word. Ooh, don't heel strike. Don't worry about it. Like 80% of people heel strike. It's okay. When you take them into barefoot or into a minimalist shoe, often what you can see is they come much more onto the midfoot. Now, if we look at that in terms of a graph, what you see is with the shod or thick trainer, you'll see there's a spike at initial impact where they put the heel on the floor. There's then a slight dip, and then the impact level goes up again, and this is your ground reaction force curve. So for the shod runner, impact, little offload, and then a slight load again, where you take the weight over onto the foot. With a forefoot runner, you'll see that it's more of a nice smooth arc as they put the ball of the midfoot down, all the load goes on, and then it all gradually comes off again. So there is definitely, from that point of view, a difference in terms of the ground reaction forces that we see. But is your body ready for that kind of change, and how quickly do you want to do it?
Would it be fair to say that the concept is a good concept, but that the way people are going about it is needs some more work? It's it's a gradual process.
Yeah,
that
absolutely.
Can take quite a lot of time.
Absolutely.
Yeah, and that's essentially the reason why I haven't been to see you guys, because the plan was, okay, if I do this, then maybe I should go to a 4-foot run. And then I quickly realized if I have this race at the end of November, it doesn't matter I need way longer. If I'm going to change to a new style of running,
But here's my question, sorry to interrupt you, but why would you, what would be the reason? If you're comfortable wearing shoes, this is a really simple question. If you're comfortable wearing shoes, why would you move to a minimalist shoe? What would be the point for the layman, not for the elite athlete? Because then you could see performance differences. That would be the reason then. But for average Joe,
I think, again, though, it's performance differences. So, if you're racing in 2 weeks' time and you think this pair of minimalist shoe, because of the hype, is going to make me run, 30 seconds faster, and you've got this in your head that this is what I want to do, that's what you're going to say, well, this is my opportunity to do it. I'm going to get those shoes and I'm going to run in those. In terms of efficiency of run, that also, using less energy, less braking, when you change your run technique, but that doesn't always equate to you running faster. It very much depends on the individual. I don't know if I like that word, because braking kind of instigate it goes straight into my brain as a physio that you're braking into your joints, and if you're a heel runner, it doesn't really mean that, to physically put a lot of force through your joints with just putting your heel on the floor, you'd have to go a pretty long way, I think. It's a normal pattern of running, and it's a natural pattern of running that, as I say, 80% of people do. It's just that when you look more to the elite side of things, you will see that they run on the mid sole of their foot, because we are looking for efficiency and we're looking for speed, and they've been trained in that way over years, not in the last 6 weeks before a race. I'm going to change my style to this, and that is ultimately how you end up in injury street, especially sort of tender Achilles,
I think just in
days.
relation to that, the runners you work with, it's not always about big changes in footwear, etc.
No.
Like, so even for yourself, Keith, we often see people that are coming in just to have a look at their running gait and have some cues in their head throughout their race that will help them, not only get quicker, but just to get through it. Yeah, exactly. And so little cues like, spine tall, or you frequently look at cadence, don't you?
Yeah,
and
cadence is a really
thing
interesting one. So I'm very much a believer that because you're never taught to run, your body develops in the way it wants to, basically. So you'll have certain areas that have more tension, like some people store more tension around their hips, some people store more tension around their hamstrings. And there's a couple of little things that when I do a run assessment, I change one or two things, and that will tell me how your body naturally wants you to run. So some people will instinctively be a heel striker no matter what I do with them. Okay, we can cue them and say go on your forefoot, but to my mind those people will then end up with things like Achilles tendonitis because they're already got a little bit more tension through the posterior chain, and that over stresses it. Whereas other people will go from being quite heavy heel strikers to more midfoot with a simple cadence change or a different cue, particularly around the hip area, and then they seem to settle into that quite nicely. So it's very individual, and it's depending on your needs. If you're a 10k runner, I'm going to see if you want to get faster, I'd coach you in a different way to if you're a marathon runner, because you don't run the same way, and there's no need for those.
What are the
those
main
two
differences?
Things. Well, if you're doing a shorter distance, obviously in elite marathon running, their technique is fairly consistent. They have a
thank you.
They're basically sprinting. Those guys sprint.
Yeah, they're basically sprinting.
It's
right?
crazy.
So their time on the ground is minimal. Their cadence is super high. They're not overstriding much. They're midfoot striking generally, but they have quite a good knee pull through. Now, generally for you and me,
Elite.
elites.
Yeah.
To begin with, I wouldn't
low
cue
level
that. Semi-pro. Yeah. I wouldn't coach that, because a lot of the time, even just getting upright body position or hip position is the first point of call. So we'd start working there. I like to think of it as a house. Like, you need a stable base, like a foundation, and then we slowly put the brickwork in. So we start to look at, once your middle is correct, what do we do with your legs? How much heel lift do we need? How much knee through do we need? What are your arms doing? So it's like gradually come up until you've got a nice house with all the little bits.
So we live near Kite Beach, if we're going for a walk or run along there, runs don't happen that often.
Not at the moment. It's been the summer, come on.
When you see people running by, I just see Hannah's brain going, like, if their arms are going across the body, it's like, look at this, because, the rotation you should have, and what is it? Pocket to mouth.
Yeah, so they, obviously when you waste energy, particularly in marathons, if you waste energy rotating left to right, I mean, it's a waste, right?
Yeah,
so I'm always like, well, that's no good. What's he trying to do with that? Where's he going? Does he want to go over there? He's going to be going forwards. So you do get some funny games.
No, you're
probably watching Keith. Look at it.
I need to. I sounds like I need this.
You run on Kite Beach, don't you?
I find a 10k, short run, boom, done, easy, tired, but no big deal. But it's
you need to run faster then.
It's when you're 24, 25 k's. And you're dragging your knees, you're just, and you feel like I've got a nice long stride, but if I catch my shadow, like, there's no heel flick, there's no heel raise at the back, like, I am probably in the most ineffective run, but it's just, all right, let me just do another 800 meters and then I'll get to whatever corner I need to get to. But that's where I find the struggle is. It's not at the beginning, and it's also then I'm thinking how I need to run. But I'm so tired. My brain is tired. Like, I'm not thinking anything clear. You've got that just pure brain fatigue. You've been running for 2.5 hours.
Also, because I feel like I used to run a lot before my accident, but I remember after 2 hours, you'd run out of things to think about. Like, you made up every scenario in your mind. You get to 2 hours and you're like, I'm done.
All the voices in your head had a conversation.
Yeah. Yes.
And
got bored and left.
Exactly.
Yeah.
So now it's like you on your own, and it's like, whoa, what do I do now?
Yeah.
So.
And then, but you're thinking about technique at that stage. That's where I need it, but that's where my brain is like, okay, if I just 100 more meters, then I'll quit. 100 more meters, then I'll quit. It's just quite hard.
I think that you need to find a more positive way to look at that, even though it's painful.
Yeah.
I think that's the wall phase, right? So a lot of people struggle with that.
Yeah, and that's halfway.
And that's halfway.
Yeah.
normally you get to around sort of, what is it? I'm thinking in miles. My brain's going 18 miles. What's that in kilometres?
I have no idea.
I don't know. Anyway, but
Yeah.
it's really far. Yeah. So
5/8
maybe
or
finding
whatever that is.
something that you just keep in the back of your mind that you haven't thought about
Well, I think
for a little
you,
bit more
you
positive.
know, you've got a big motivation to be doing this marathon. So, you know, that's probably where you...
Yeah,
Yeah.
now it's gone public.
Come on, Keith.
Now it's gone public and everyone knows about it. So we'll
No
see
pressure.
we'll see how that
No
goes.
pressure.
So let's get back.
Go on.
Let's get off me. What kind of injuries are you seeing with people who, but the difference between the heel striker and the forefoot striker?
Okay. Well,
Like, and I ask that because what if somebody is trying to think, I keep getting shin splints or I keep getting Achilles thing, is it my run?
yeah.
Is there a way they can shape their mindset on that?
So when someone comes in with an injury, say let's take Achilles tendonitis for example, it is quite important that I look at their run to start with to see what they've been doing. And one of the key things I always ask them is, have you changed or tried to change your technique in the last 6 months, for example? Maybe even longer. It depends on what their presentation is. But when we look at their run, if they've gone from being someone that's a heel striker and they've tried to change, they're like, I've bought these new minimalist shoes, I've put myself midfoot, and I look at their run,
I can see my toes.
it's often that they have tried to change their technique or they've fiddled with what they're doing with their shoes, and it can make a difference. I'm not going to say that shoes are the be all and end all. It's very much how you run in your shoes. But if you put someone that's a heel strike into a forefoot within 6 months, I think that's too quick, and they do tend to get problems with Achilles tendonitis after that, and it's purely load related.
Achilles tendon issues. What's the too quick bit? Like, they just have to be more patient with their progressions and their distances?
Yeah, so the thing with, it depends what your history is like. So if you've been a runner your whole life and all of a sudden because you met someone and they said, you'll get faster if you do this.
Oh, you read that book, yeah.
Oh, you read
you said that to me. I
book,
changed
you're
because
like,
I read this
"Woo."
book.
Yeah, I change every week when we talk to someone new on the podcast. I'm like, I'm doing this week. So I understand that.
You have to have, from my mind, you have to have good reason as to why you're doing that, what your goals are, and also to think about how far you're running. Okay, because if you are a marathon runner, I would never put you onto a forefoot to run a marathon because you won't last.
Yeah, it's far. Eh?
It's horrendous,
Yeah.
and your Achilles just won't take it, and that's a given. You know, I ran London Marathon a few years ago, and I started out behind this lass who was trotting along on her toes, bouncing around, and I thought, poof, blimey, you're not going to last very long, are you? And then obviously you get muddled in, didn't see her, but I just don't know how anybody can run on the forefoot for a marathon or an ultra marathon. It just doesn't seem to work out.
Yeah,
that way.
like the elite guys are doing it, but they're doing it in 2 hours and 30 minutes. They're not doing it in 3 hours
Correct.
and 4 hours.
Yeah, and their training is to supplement that. And again, they've been training at that level for years. It's not they've just decided in 6 months, right, let's do this.
Of course.
And if you were to do that, again, there would probably be a little regime that we would give you to try and help you supplement that change. So looking at running technique, I always say it's going to take you a minimum of a year. So if you look to change from heel strike to midfoot, give yourself a year, work on it slowly, give yourself exercises that help to supplement that. If you're a heel striker and wanting to go to a forefoot strike for whatever reason, again, that's quite a big change. So not only are you going to need to let your feet get used to that, you also have to let the rest of your body get used to that. So right up, hips, back, everything. And again, I would give yourself even longer for that transition, particularly if you're going to be racing and you want to race in forefoot. I'd say that's at least a year and a half, maybe even up to towards the 2 year mark to be fully forefoot happy, no injuries.
So from heel strike to forefoot, you're talking a year?
Yeah.
You just said you want to give the rest of your body a bit more of a chance to adapt. What considerations are you thinking about there?
Yeah, so when you change the way you run, you change which muscle groups you use. Okay, so generally, the evidence is a bit wishy-washy on this, but generally from clinical experience, if I take someone and put them into, again, this is not me making them do this, I put them into a certain rhythm that tends to make people run midfoot. They always say, I can feel my glutes work, I can feel my bum muscles working more, I can feel my hamstrings. And And usually when they've been running, all they can feel is their quad, and they feel pressure in their knees. So this is something that I might do with someone that comes in with knee pain. I'm not a physio that would ever stop anybody running unless they've got like some sort of fracture or stress fracture, something like this.
We spoke about a guy who had that, didn't we?
Yes.
Well,
So
yeah, he had to stop.
he was an interesting one. He did have to stop. I actually need to follow him up. He disappeared. He was a really interesting one, actually. Yeah, he had an interesting...
Yeah, I'm curious.
yeah, go on. Sorry, I'll elaborate.
Yeah.
So I had some... It was actually... Do you know how it came through? And we were talking about social media recently on a podcast. I did a post talking about shin splints, just a couple of exercises because I had a basketballer. And an old friend of a friend messaged me, and just with this kind of history of, should I do this if I have shin splints? And the way we were talking, I was like, look, actually, it sounds like you need an assessment, so go off and see Hannah. Just because he was it was text. I couldn't do anything in text. I was like, look, you need to get an assessment if this is the case. He was just getting pain on any sort of distance.
And change of
oh, he got playing football as well. Yeah, he stopped playing football, and he's a big he's in the business, the football world business wise. So it's crucial for him to be able to play.
It was quite interesting. So when he came in, he actually he'd taken an impact directly from a stud to the shin, and when I looked at his X-ray, he had. It's not your typical stress fracture, but it's a mid-tibial stress fracture that he was presenting with, and this was 2 years down the line. And I'm like, this guy's young. Why have you not healed? And when it took ages, we sat and talked through everything.
Whoa, sorry, 2 years later, he still had a stress fracture?
Yeah.
Whoa.
And he had he's had a recheck, so he'd had another X-ray done, and it was healing, but I could still see that it wasn't fully healed, and obviously he was still presenting with some pain. And we took ages, and a lot of the time for me, I just need to sit down and understand what these people are doing, and it really helps me treat them. So when I spoke to him, when he'd initially done it, he'd done nothing about it, which is fair enough. You know, you take a hit to the shin and you carry on, right? It's
you don't
normal.
think that it's going to result in a stress fracture.
No. But when he had identified that it was a problem and had it investigated and been to have it all checked, he then ignored the advice of the practitioner that was treating him. So he'd carried on doing running and football and bits and pieces. And he had progressively got better. However, obviously when they got in contact with you, he was still having problems. So I looked at it and thought, oh, this is really odd. Why is this not healing? But the history basically told me that he'd just not let himself rest and recover. And again, one of these people that wouldn't stop doing.
So he was continuing to play basketball and it was never healing
continuing
properly.
To run, continuing to do all the things that when you have a stress fracture, we ask you not to do.
Yeah, for obvious reasons.
For obvious reasons.
Yeah.
You can obviously do gym work. And I was saying to him, look, give yourself 3 months. Just take a time out, stop running. Do your gym work, keep yourself fit this way, but let that heal, because the only other option is to go and have that operated on, which isn't a pleasant idea either.
And this is frequently where I would see clients from the doctors and from the physios in the clinic, is because they'd get a client like that and they're like, he needs to be doing some form of exercise or training, but we can't load up his, say if it was his right shin that had the stress fracture. And then you give them alternatives. So you go with them, you give them a gym program, you show them other different ways that they can get that exercise and training buzz without actually, and include their rehab exercises. So they're kind of killing two birds with one stone, but not affecting their joint, only in a positive way. So yeah.
Yeah, so it was a really interesting one.
Well,
I'll find out where he's at.
Well, yeah, because his business is with professional footballers, so they come out here during their vacation time, and I know that he goes and kicks a ball around with them because it's part of his building rapport with them. And then he used to go for a run on the beach every now and again. But so going back to the actual stress fractures from the heel strikers you're talking about.
So heel strikers, again, this isn't typical, but you tend to a very common stress fracture in running is tibial torsion, so tibial stress fractures, which there is some evidence to say it's related to pronation, and then there's other evidence to say that it's not related to pronation. Generally, that is the most common one that we would see, along with fifth metatarsal stress fracture. So that will be when maybe someone's trying to change their running technique and they go more forefoot. They can end up putting a lot of pressure on the outside of their feet, and with repetitive loading, we end up with stress fractures. Now, I always think, and from our learning a few years ago, and clinical presentation, stress fractures are always there for a reason. So very often we'll see that people have either gone from zero to hero, so they've done nothing, and then they've decided in 3 months they're going to run a marathon, which your bone structure physically isn't ready for at that point. So our body's very clever, and when we put it under stress, it has the ability to remodel. So our bones have these very small fibers in them called trabeculae, and they grow and strengthen along the lines of stress that we put on them. So when you don't give your body the chance to remodel in that way and prepare for the stress that you're putting it under, it breaks down, and this is what we see with stress fractures. So if you go from zero to hero, obviously that's the result that we see. The other thing tends to be, unfortunately, runners tend to think that being lighter is better. And there's a difference between being light and being malnourished. And when you don't eat enough, there's a condition, particularly in female runners, called female athlete triad. They tend to end up doing a lot of training, they don't eat enough, they're very underweight, and we start to lose their bone density. And these particular athletes are very, very susceptible to stress fractures, both fifth metatarsal and tibial stress fractures.
You can imagine with these type of clients that we see, you're opening up a can of worms here with this sort of stuff, but you have to face facts with them and explain to them exactly why this is happening. And that's when, I was talking earlier about when we did our postgraduate diploma in sports and exercise medicine, that's a key part, their lifestyle, their nutrition.
It's also psychological as well.
Yes, exactly. So, yes, they have this stress fracture, but the reason isn't just from their increase in load. It's because they are not getting the right nutrients into their body, and they're, underweight. So
and not resting.
It's a big problem as well, because it's often they try and say that it's everything else but this, because it's not a problem that people want. I have to be light to run quick, but you can't run quick with a stress fracture. So we have to very gently tease that out of the scenario and try and fix that, because otherwise we can send them back, we can let it heal, send them back running, but it will happen again. So.
Yeah, that's a difficult one. I mean, that's the case of, did they get injured because they're malnourished? Or no, rather, are they running because they want to lose weight and become slim, or are they becoming slim because they want to run and they want to win their race? Very different patients there.
Yeah, and this is what we love being part of a multidisciplinary team, is that within Valiant Clinic there is a dietitian, a psychologist, a health coach, physio, sports med doctor, radiology on site. So this person with a scenario like this can avail of all these services under one roof, and we all liaise with each other for the benefit of the client. So if we just determine that, well, actually the biggest thing now is that we sort out your diet, along with giving you the right rehabilitation exercises and giving you alternatives of training, so you get that exercise fix, then you're going to get better much quicker. And
yeah, that's awesome that you guys have all that full team there.
We're super lucky. It's almost like we've got the sort of setup they'd have in an elite setting, but we have it in a clinic here in Dubai.
So at the moment, one of the things they've rolled out is for executives called Well 365. So it's they take some of the, at the moment we've got some of the top businessmen in some of the companies around Dubai, and the business has put them through this program, and essentially they get everything screened. So it's a really proactive take on the medical world. So they come in and they see me for like a movement screen and review of their current exercise. They would see the optometrist, check out their eyes, see the endocrinologist, see everything that works, and so that they have, for the business's point of view, they want that their top guys making decisions are in the best of health, and that they're not out sick with for weeks on end, and if they need to see a health coach for stress management, or if they need to see a dietitian or whatever it may be, they see all these people, and it's within the clinic, and it's great. So we have a team meeting then, where we were there on last Wednesday, and we discuss each of the cases, and from your point of view, what did you find, and what does this person need to work on? You have everyone there from you know, like I said, people looking at their eyes, to the dentist, to everything.
That's
so
awesome.
Like
really
elite
thorough.
sports monitoring in the corporate setting.
Yeah.
Say it again, sorry.
It's like
The
how you would
corporate
look
athlete.
at the corporate athlete.
Yeah.
The
But the
pro.
thing is that all of that, improving all of that, is going to obviously make people a lot more productive
Yes,
and make them a
that's-
lot more efficient in the way that they think, and maybe healthier and make better decisions, as opposed to maybe sometimes unreasonable decisions. So
Well, I think
there's a lot of benefit.
when you're not in the medical profession and you are in a more corporate environment, you know, day to day, your body and your health isn't something that you would think about.
No.
And our bodies at the end of the day are something that in this world we cannot buy another one. You know, we only get one. So if you're not aware of it and you don't understand it, because we're not all medically trained, and that's completely fine, it's normal, but it doesn't mean you can't look after it.
Yeah.
Because it's not like going to Lulu and buying a new part for it. You know, it's going to the mechanic and get a new wheel. We can't do that.
Yeah, I think that's it. People don't understand, isn't it? So, like, while they know they have to be healthy. All right, I've got
Why are we being healthy?
I've got 12 meetings today. That the health has to go.
But that gets neglected so much.
Yeah.
Like, I know so many people, and they work 12, 14-hour days, and they drive to work, they sit in an office, work a 14-hour day, meetings back to back, go home, eat dinner, watch Netflix on the sofa, and then go to sleep. And they do that every single day.
But I promise
and over time, that just, people end up like putting on weight because they eat takeout every night. They end up with back problems because they sit all day.
Yeah.
Like a huge like multitude of problems.
Yeah, and I bet throughout the whole time, they are aware that what they're doing is not healthy. They just don't have a choice. And that worry begins to build up. If you can go and just get like a mechanics, just show up at the door. You just follow the conveyor belt. You get your movement screen at the beginning. Okay, movement, tick, tick, tick. Okay, we need to work on this. Health, bones, joints.
Do you know the other
That's
thing?
awesome.
I think that a lot of people don't realize how long it takes to get better either. Like and this is something that really was very apparent to me. I think most people are like, oh, we're going to get better in 3 months. And it's like, no, like it's not 3 months. It takes a lot longer, and it depends, particularly if it's a non-communicable disease that people develop, things like diabetes. It can take 2 to 3 years for them to reverse the damage of 20, 35 years of bad eating.
But I think, and I'm sure you have this with your clients, you know, we all work in the health industry, is that, you know, if you're setting achievable goals, like short-term achievable goals, they're much more likely to make it and change those habits, you know.
Yeah.
So that's the biggest thing.
Yeah, I think the thing is, even from like an injury perspective, you know, the severity and the longevity of that injury from the point where you meet the practitioner you're going to work with to get better, that often indicates how long it's going to take you to get better. So if you came to me with a muscle strain, I might say to you, I'll have you back in 2 weeks, no bother. It won't be completely healed, but you'll be back training. But if you fall from the roof and break everything,
like me,
it's going to take a year to 18 months, you know, to feel more normal again. And that's the thing that a lot of orthopedics don't tell you, and particularly here in Dubai, I find this all the time. They're like, oh, we'll do your shoulder, no problem. So they go in, have a rotator cuff repair, you know, stitch a few things up. You'll be fine in 3 months.
Yeah.
Excuse me?
Yeah.
So it, again, depending on your level, like if you don't do anything with your body really, you just go to work and you just type, you don't lift anything, you don't drive, 3 months, yeah, okay, maybe. But for anybody that has a slight interest in doing anything active, we're going to be looking much more down the 6,
1
8
1
months,
to 2 years.
1 year,
I know. After I left hospital, I got given like a note from the hospital as to when I could go back to work. And so I broke everything, came back, I got a note that you can go back to work on September the 1st. That was 2 months later. I just had 14 surgeries, everything reconstructed, and I got 2 months.
What did they think you did for a job?
2 months.
I was like, September 1st, I was still in a wheelchair. I couldn't even wash myself. I was like, what? Are you crazy? And I could sit in a wheelchair for 5 minutes without feeling like everything was so heavy. I was like, I need to lie down. I've been here 5 minutes. But 2 months, that's what I got given. I was so shocked. 2 years later, that would have been a more appropriate like work sick leave.
And that's the thing, isn't it? You have to be realistic in your targets. So as Taif said, like if you'd said, right, okay, well, my first objective is to get back to work, giving you a reasonable timeline and like little gateways almost to get to that goal is more appropriate than saying, don't do anything, off you go to work in 2 months.
Yeah.
You know?
Keith and I were on an excellent course last weekend called The Sporting Knee. A guy called Tim McGrath came over to Dubai. He's based in Australia, particularly with the University of Canberra, and works with a lot of teams there. He has both a private clinic and works with some of the top rugby teams in the region. Anyway, in relation to that timeline, it was about, and he liaises a lot with the surgeons that are giving a realistic timeline. And now he's in a world of elite sports, so it's very important they get back as quick as possible. And he was talking about how to periodize your rehab just the same way you'd periodize training for an event. You know, how if Keith's building up to do this marathon, he's going to be gradually building his volume up, and then close to the time he's going to reduce the volume but increase the intensity. And same thing with rehab. And it was really interesting. And I think there was a load of clinicians there, predominantly physios, and they all, you know, we all were thinking, well, actually, I don't think we're as on the ball as we should be with setting a timeline with the client and setting out what we're doing, you know, and so they can see the plan and being realistic about it, not, you know, 2 months posts.
A big thing he talked about as well is speak to the client. Be careful of the language you use, first of all. You know, like don't overpromise, don't underpromise. And in a sporting environment, be careful what you say to the coaches.
Yeah, we spoke about that on another podcast, that you can really change people's minds by what you say to them, particularly if it's negative. People attach themselves to negative comments so much more than the positive ones, and then they're stuck. Like, I can't do anything because I have a knee problem.
Yeah.
So listen to this for a statistic, right? When we were doing our course, and this is now research study that's banded around a lot in the medical world. If you go in with low back pain, if you they scanned over 2,000 people that didn't have low back pain, okay? And 91% of them showed that they had some form of disc bulge.
Wow.
Okay? 91, none of them had low back pain. Now, if you came in with low back pain, and I immediately order an MRI, and you said, Caroline, you've got this nasty disc bulge, this. And then all of a sudden you've got in your head, well, that changes. I'm not going to pick that up from the ground. I'm going to have to be very careful. And it's exactly what your back doesn't want. You know, you need to be moving, in the correct way. So that was a big thing. And then you develop this chronic pain pattern that we've all seen with clients, where they have fear avoidance of movement. And it's quite like a vicious cycle.
I don't like going to doctors anymore because they always find things wrong with me. It's like, you have arthritis, you have this is going to fall off, and I just can't listen to I can't listen to that.
I remember waking up after I'd had my second knee reconstruction with a rugby injury. And the doctor was there. He was a young doctor, and he was like, just to let you know, don't expect that you'll be able to play rugby again. And this is just after surgery. And I was like, brilliant.
Dave,
it's a good job.
I got the you're never going to walk again.
You have to be working in 2 days.
I know. I got the you're never going to walk again, but here, 2 months off. Like, then you can go back to work.
Yeah.
It's like, thank you.
But I think you take everything with a pinch of salt, you know. And I think that they're bringing more and more of that stuff into the medical profession now, where you learn how to communicate better with. And now in Ireland, so you can get a maximum of 600 points in the Leaving Cert to become everyone wants to do, very popular to do medicine. So to get into medicine in Ireland, you need 600 points.
In your A levels or your end of secondary school, high school exams.
So you need to basically
get everything right.
Everything right in your exams.
But
what they were finding was that there was a lot of really, really smart people at studying and passing exams, but could not communicate with clients, which is, you know, such an important aspect of the medical profession. So they now have there's 2 exams. One, you sit an interview and you get a personality test.
Really? I didn't know that.
Yeah.
Wow.
So if for medicine, so that backs up the points you get in your exams as well. So it's not just on
academic answers. Yeah, that's awesome. That's very good.
But that's why now we see more coming through. The doctors are much better at communicating with the patients, because if we speak to everybody in medical speak, like, I don't understand it sometimes. You know, But I just turn around and say, look, I'm sorry, I don't know what you're saying. Can you explain that in a different way? Whereas when you're a patient and all you want to do is like, sometimes you just want to get out of the room.
Most of the time they want to get out of the room.
Fine. And you know, you're gone and you leave and you think, I actually don't know what
I was showing someone around the clinic there recently that runs a very successful sort of a gym in Dubai, and he said, you know, we want to link up with a company that when our client comes to you and they come back in, they can explain what's wrong with them.
Yeah.
And you know, that's a thing, and I
so
just can't
important.
believe clinicians don't prioritize that when you leave, you should know exactly what's wrong with you and what you should do to make that better. That's
Instead,
the biggest part of it.
You get a report where you can't read any of the words.
There's lots of long words in it.
Even if you have a report, that's better than not having a report, because I've people come to me often and goes, the doctor says I have a disc in my neck. And I'm like,
good job. I'm pleased.
I know.
Snap, I've got one.
Yeah, we've got 7, but like this isn't. You can't say that to this person because it's not their fault. They have in their life up until that moment, they never thought about what was in their neck. You know, they didn't care.
And it's back to not having that awareness of
exactly. So they come to go, I have a disc in my neck, and I'm like, I need more. I need a little bit more. Okay, and then it's about trying to find the report that you got in the scan and then trying to rely on the report. Let's hope the report was read well back at the beginning. Okay, let's work from this. At least if there's a report, we can
But you
can
can't
move forward.
read.
But when I had another guy message me saying he had a big long text on an Instagram message. He had risky shoulder blade.
Oh, bless.
What?
In a big long
Risky.
risky. He'd been given too much information and he had remembered it all in the sense where he'd sat there and gone, something about his spiral line was wrong. He had risky shoulder blade. He had tightness in this, and it was too much.
I'm going to have to Google that. Risky shoulder blade.
Yeah.
Not heard of that.
I don't know what it was. It could have been anything. But the fact that this guy was the opposite, he was so, I'm going to remember this all. But it still doesn't go in because they don't have the grounding in the terminology. So it's like the report, get a report. Or the one thing I would say is if you're in a assessment or you're anything, write it down. Just, you don't have to remember. You're not expected really to know. Like, I'm not expected to know what's wrong with my car. If you tell me my carburetor is broken and my piston's broken, I don't know what that is. But I don't have to. If I turn to this guy and go, can you fix that? This is what's wrong. I expect him to be able to. That's what you're paying for.
And I think the other thing to remember is that, look, from a physical point of view, we don't really treat scans. So, as Taif said, if we scan you, we'll find all sorts. And that's normal.
Maybe even a risky shoulder.
Maybe even a risky shoulder. But that's completely normal. So from your movement perspective and from a physio perspective, yeah, okay, let's note it. Keep it in the back of our mind. But that person's probably had this for ages.
Yeah.
You know, they've been working on this.
It's normal for
it's
that
normal
age
for
group,
them, you know. They've had it they've been working on it for years. It's not something new.
Well, what I like to do when I get the report, because I'm in a gym now and I'm reading the report, is I talk about all the things that are okay. You know, no joint effusion, no this, no that. Look, that's good. All right, you got this one thing, but there's like 10 other things that are great. All right, let's get going. We can work with all this. We can make all this work. And it's kind of shift their perspective on it, but at least they feel like I've addressed it.
Yeah, and you have to look at it.
Speaking positively about the things that are right with them and what's working, as opposed to just continuing to give negative information. Yeah,
it's a crazy, the whole communication, because the other thing I was thinking as you were talking earlier is you can teach somebody how to communicate with people, but when you only have 15 minutes or 20 minutes, you don't really know what kind of a learner the client is. Whether they're like, do you understand if I just beat you with information, or do I need to draw on the board? It could be 4 or 5 sessions before, because I know I've spoken to people, some of the guys we play rugby with, I've spoken to in the past, and I can see them clued in and they get it, and I know they get it. I can see the cogs turning and they're out the door. They understand what's going on. But then you speak to other people and they're like, yep, and it's like, oh, okay, you're not getting it, no problem. I need to come up. I need to say it a different way, or I need to say, okay, let's get going and maybe I can explain it to you over here. And then right at the end of the session, they go, oh, and it's like, good, that's fine. It took us an hour, but I don't mind. At least you're leaving now and you're going to come back next week and we can move from here. What have you got, like 25 minutes in an assessment? Or sometimes GPs have 15 minutes with people.
Do you know what's interesting? I read something about the US, about doctors in the US who were getting sued, and they did this study about it, and they noticed that doctors who spent 5 minutes more with their clients were getting sued so much less than doctors that were seeing their clients at like 5 to 10 minute intervals.
I don't know how they managed with that. I made it a clear thing that like session time is so important, because you leave, like we said. I get the client at the end of the session to repeat exactly. I ask them, so tell me what's wrong with your knee. And they have to tell me exactly. And I said, and how are you going to fix that? And they have to tell me and explain to me and show me. And then I go, okay.
I'm going to start doing that. I'm going to start doing that. That's good.
We're very lucky that we're in an environment where the boss respects that we need that time. And that's what we're trying to do differently, because I come from an NHS background and private in the UK. And even in that environment, there's so much push on, get people through. We've got such a big waiting list, blah, 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 blah. That's all very well and good, but if I can spend 40 minutes with someone and take the time, we've got some lovely apps that we use. We look at their scans, we show them the apps, we explain things, get them to reason it themselves. Do you understand? Yes, no. That extra 10 minutes of doing that might mean that I get them better in 5 sessions rather than 10.
Yeah.
So actually,
it can speed up the waiting list, because these people aren't going to join it.
Because I'm not having to see them as much,
and
because they're
also
happy. They're like, I know what's wrong with me. I know how we're going to fix it. This is what I need to do. And we go from there, whereas we go around in circles.
I think a big thing within Dubai, that we're seeing, is that insurance companies are clamping down on what is covered, and they're reading very deeply into, what you're doing with your client, which, is twofold, because it's great in the sense that people that have been seen by a clinician for 30, 40 sessions and isn't improving, they're flagging this and going, right, they're either not doing something right, or they need to go elsewhere. And so that extra bit of time, if they can see that you as a clinician can get buy-in from your client, and that they're recovering from their injury in a quicker amount of time, it's going to help everyone, and that's a big push here. And Keith and I discussed this weekend how a big thing in the UAE, particularly in Dubai at the moment, is a push for medical tourism. I think there was a statistic that the UAE government spent 30 billion last year sending people from here overseas for treatment.
Really?
And so and the main places are Germany, Thailand, Singapore. Those are the 3 top destinations, and then England comes just below that. So from here, that they will go there for treatment. And the idea is that, especially among the GCC, everyone comes and gets treated within here, and that we have not just the facilities, but the expertise and knowledge to provide that service here.
And the communication.
Yeah.
Because here, obviously, we have so many cultures and languages. And, if we're all going to communicate in English, we need to give our patients, if English is not their first language, enough time to understand what we're trying to do. I think that's something that in most healthcare facilities...
Or give us enough time to learn Arabic.
Arabic.
My once a week lesson is,
You guys are learning Arabic?
Slowly. Very slowly. But at least we're trying. So that, it is a super important, and I think being realistic in their expectations as well. So making sure it's not going to be 2 months, it's going to be 2 years. Okay, this is what you're going to have to do. But at the same time, some doctors, because they're not directly involved in rehab or exercise, they actually wouldn't know the time frames.
It's all well and good that you have a bone that's fixed, it's been molded together with all of this metal, and then they're like, my job is done. But that bone can't take weight, it can't walk, it can't move, it can't do anything. So it's really different.
We were also saying this weekend that how personal trainers have a role to play in this, because especially in Dubai, it's very common that clients that you'll see will have a personal trainer, and the more knowledgeable and up to speed they are in injury. I mean, I was very impressed that there was a girl that came on the course with us last weekend.
Yeah, one of the trainers, Sporting
Knee, and she was a personal trainer, and that's someone that I would certainly be keen to send my clients to if she's doing that extra, study in this area. She'd be much more up to speed, especially, like I said, with this push with medical tourism. If they can attach themselves to different clinicians, you can get a good referral source.
Well, this is the whole reason that we decided to start this, because of that reason. because like I remember going to loads of PTs. They were all like, we're rehab specialists aside from you. And they were just doing ridiculous things with me. And obviously because I'm in this industry, I was like, this is not right. Like I was going into a gym on crutches, and then they were having like me sit and lift up and stand with a weight. And it's like, I can't even walk. Or this guy put me on a power plate.
Oh no.
And my feet were full of metal. I started crying and I got off and I was like, I can't do this. And I left. That was number 3. And then I went somewhere else. But you'll be so surprised how many people here are saying that they're one thing and something totally different. And they have no,
obviously something that we've tried to create a little bit since being here is that you have a network of, I have a network of personal trainers that I work with. Like Keith, that was one of the starting points how we got connected. But it's super important because if I'm trying to achieve something with a patient and you're doing something else, we're fighting against each other, and actually the patient in the middle is the one that suffers. So it's super important that we both trust each other. So for example, like if Keith was to send me someone and I go, nope, not training for 6 weeks, sorry, you're going to be like, what on earth is she doing? You know, whereas I'll say to Keith, okay, cool, like got them, this is what we're going to do in your sessions, please can you not do this, this and this, and I'll give you an update next week once I've seen them, and then we'll progress it on from there. And it works really well, you know, and they actually get better.
You can do this, you know.
Yeah.
Well,
I only say that to Keith. For the patient, it's all like, yeah, do it.
I think as well, what's important is people shouldn't be afraid to ask, because one of the things I was impressed about on that course was that trainer she was putting her hand up, and like when I walked into the room, I felt a little bit because everybody here is a physio. A couple of people we've had, Brian and Miffy, they were on the course. And I was like, oh dear. And the first thing, I was 10 minutes late. First thing that
Keith
classic
Keith.
First thing I see on the board is MRI scans, and he's talking us through trochleas and all these things, and I was like, okay, this is gonna be a long end. And I know the girl, so I thought, wow, she's gonna really struggle this weekend. Like I hope, because I told her about the course, I hope she doesn't think I sold her out a bit. She was putting her hand up and asking all sorts of questions that, granted, many people in the room might have known, but she didn't know. I was like, yes, good, ask.
I'm sorry, but some people in the room wouldn't have known.
Possibly, but this is the other thing I did say to her before. I was like, look, everyone's there to learn.
Yeah,
and
absolutely.
what you know, other people don't know.
Yeah,
and what I know, other people don't know. And what they know, they don't know. So, like, we're all there to learn. But I was so impressed that she was just jamming her hand up and going, excuse me, can I just ask what that is? And I was like,
good
yes,
for her.
good. And everybody was so helpful to her, even because Tim was fantastic. But even the other physios she was sitting beside were helping her out. Nobody looked down on her. Nobody said, hey, you should know that. And it was like, no, ask questions. If you don't know, ask. You get way more respect and admiration, and people are going to be way more helpful once they understand that you don't understand. I think that's so important when you're trying to learn. So if you're in a communication with a physio, and the physio says, bah, 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 don't just go, okay, got it.
Yeah.
And then
definitely
do the disservice.
Ask, because the communication between us is just as important as the communication between the patient, you know.
Yeah.
So, and don't worry, that's something that is consistent through all medical training. I think actually is people not being confident enough just to say, actually, I don't know, and that's something that we've both had experience of in the past. And now, as I'm leading a department, it's something that we have a policy where we say, you know, no question's a stupid question.
Yeah.
Ask it. If you don't know, don't muddle through, just ask. And it's the same from patient to colleague to anybody, you know. Even with the doctors, sometimes they look at me and they're like, you don't know that? I'm like, well, no, because I haven't been working in respiratory medicine for nearly 8 years. Like, I can't remember this stuff, so give me a heads up. What is it you're trying to tell me? And it's it's safer for everybody ultimately. So
and everyone just gets onto the same page much quicker.
Yeah, exactly.
It's the end of the best thing.
And you'll be surprised, things that I don't know, you'll know loads about, and actually it's helpful for me. Yeah. So I'd like to question you about that. And I think that's great that she did that. It's really important. It's good.
That's key to any. Well, guys, thanks for coming in. Where can people follow you guys online, or do you have any websites or anything like that you'd like to push.
We need to up our social media again, don't we?
I'm off the radar.
Yeah, you can find us at Valiant Clinic. So we're on the website there, and you give the call center call if you want to make a booking with either of us.
And get that full corporate athlete pro.
Yeah,
I think we need to do this.
Yeah.
We need to do
this.
this.
The thing is, they offer their direct billing for clients, so with the majority of insurance companies in Dubai. So if you do have an injury and you want to be seen, that's it. Generally, that it will be direct billing. So
awesome.
I think the other thing, if you want to get in contact directly, it might take us a few days, is LinkedIn. That's probably the only thing.
Valiant on LinkedIn, or you guys?
No, just us on LinkedIn, yeah.
Hannah Wilkinson and Taif Delaney.
Yep. Otherwise, I'm off radar, so that's it.
Yeah,
it's probably for the best.
Really. In some instances, when you're busy doing other stuff. So,
or a dodgy past, one of the other.
Hiding from people. Cool. All right, well, thanks for coming to speak to us, guys. We'll
thanks for having us.
Hopefully have you on again soon.
Definitely.
Bye, guys. Thank you.
Bye.